This is Carla Keene, CEO and developer of ClarityRx. Today's webinar is really all about our MicroPeel. One of the things I really want to focus on is that each manufacturer's MicroPeel protocols are really designed and written around their particular product. So our MicroPeel may be administered in a different sequence or protocol than you're used to, but I will make sure that you understand the whys of that. A couple things for us before we get started. In essence, before you can be certified in MicroPeels, you must have gone through at least our product knowledge and our peel lessons or courses online. Okay, so what is a MicroPeel? This is kind of what I think is the next level or the most progressive skin therapy, combining typically a peel with microdermabrasion. What can we really expect as a result of MicroPeels? Everything that we should expect from the single modalities of microdermabrasion and or peels, but kind of taking it to the next level. We know that can certainly transform the texture of the skin. This is one of the most apparent quick gratifications that we see with a MicroPeel in just one treatment. It also stimulates all the mechanisms within the skin itself. So stimulation of water and oil production is great to form that great hydrolipidic balance to the skin. It also increases oxygen flow through massive stimulation from the vacuum or the mini massage of the vacuum located on the microdermabrasion device. It also is known to really reduce the appearance of fine lines and wrinkles. How does it do this? By really stimulating fibroblasts, which then can grow collagen. It also can diminish the appearance of large pores. Just by simply removing the filament or debris from the pore itself can improve the appearance of the orifice of the pores. Also, we see a lot of brightening as a result, lifting up some dead pigmentary skin on the surface and allowing the skin to really kind of shine through. It actually tightens and firms and tones the skin as well. And as you know, everything that we do is cumulative. So multiple MicroPeels for longer lasting results is advised. So why MicroPeels? Really, I think it's great for that client that is maybe plateauing. It's really designed for the client who has already gone through possibly a series of peels or a series of microderms and are really looking to the next level. Or when you've got a client's skin that's just not responding to you anymore and it needs a little bit something more progressive. It is something, though, we recommend that you proceed with caution. Also making sure that the client has experienced our peels in the past as standalones without any complication, and that they tolerate the salicylic acid peel okay. Our MicroPeel is done with salicylic acid only. The reason for that, in our low pH peels, the alpha hydroxy acids, being the glycolic and the lactic acid, make the skin a little bit too soft and spongy to associate or use in conjunction with another modality like microdermabrasion. On the other hand, salicylic acid actually creates a perfect canvas for the skin to then be exfoliated by the microdermabrasion. Also within the ClarityRx MicroPeel protocol, you'll see that we peel first and microderm second. The reason for that is that salicylic acid acts as a perfect degreasing and prepping agent to get a more improved or even microdermabrasion. If you flipped those with the ClarityRx peel solutions and did the microdermabrasion first, as you know, microdermabrasion is not an exact science at removing the same amount of tissue on the surface of the skin. Therefore, if we did the peel after microdermabrasion, you would find that the peel solution would grab in the areas in which it's been more compromised and could potentially cause some superficial scabbing or some hot spots and potentially some post-inflammatory pigmentation problems. So as a result, within our brand, it works best using salicylic only, and using the salicylic acid peel first, completely removing it, and then administering the microdermabrasion. And I'll explain this more as we get through a couple more slides. So this really is the next level of treatment for those that are really looking for more, or those that we just have not met their goals yet. Let's take a look at what really happens at the effects of MicroPeels on the skin. Pre-treatment is before any of the modalities are used. You can see that there's a pretty good or a significant layer of dead keratinite sites on the surface of the skin, creating kind of a dull, lifeless appearance and a very uneven texture. After one pass, and in our protocol, this is the peel solution. Salicylic acid is applied and left on for up to 3 minutes and removed. You can see just with the application of our peel solution that the majority of those superficial cells are now gone. You can also see what's starting to happen here in the dermis. Also in the subcutaneous tissue, we're seeing some more swelling, which is good. This is just an influx of water and stimulation that's going on deep within the tissue. After the second pass, which is with the microdermabrasion, so at the third point here, you're going to see very little dead skin cell layer on the surface of the skin, which is going to result in a much fresher appearance to the skin, a much more evened out epidermis in the very superficial layers, and a very nice, even, compacted dermis with lots of moisture located subdermis. MicroPeels remove approximately 2 to 4 microns of depth of the dead skin cell layer, which smooths the surface of the skin about 90%. At no time should this protocol ever result in any exudate fluid or serous fluid or any pinpoint bleeding or anything more aggressive. This is meant to be just a superficial peel. But we do know that throughout a series of micropeels, we can stimulate collagen. And one of the things that's most noticeable is that clients will see a strength in the skin or support to the skin. It also keeps the skin extremely clean by lifting dirt and debris from deep within the pores themselves, and facilitates a lot of skin turnover, which results, again, in a much healthier appearance. So who can benefit from micropeels? In my opinion, I think most can, using the variables that we have available. For instance, how long the peel solution is left on, what grit tip do we use on the micropeel, how many passes of the microderm do we do, and what is the vacuum setting on the microderm? All of those we take into consideration as we customize the application of the micropeel for most clients. The only exception to this would be our severe rosacea clients, those that are also associated with lots of redness or irritation, or any other skin disorder that elicits inflammation, redness, or irritation, or has any known inflamed conditions such as pustular acne. It's really uncomfortable for us to administer the micropeels over a severe inflamed condition. So I like to see the skin as normalized as possible. So the rule of thumb is keep in mind that this service is a standalone service, and a 30-minute protocol is probably one of the most stimulating services that you're going to provide to your client. So again, thinking along the lines of stimulation and sedation, you wouldn't want to overstimulate an already highly stimulated skin type or one that has an increased sensitivity level. On the other hand, I love this service for a real sluggish, congested, comedone-prone, mature skin type that has real rough texture. It's just the instant gratification service for that. So when is it appropriate to start with micropeels? Again, as I mentioned before, we like the clients to successfully go through peels without any incident first, both potentially as an upgrade and as a standalone series. It really is considered the next level, so I wouldn't want to bypass the series. The natural progression for a client is to come in and experience a facial, then potentially experience a facial with an upgrade, and then potentially spin off and do a series of microderms or a series of peels, and then I think the next level would be the micropeel. Some things to be concerned about: if your clients have any of the following conditions, we should avoid microdermabrasion and peels in general. So, of course, it would be contraindicated for the combination modalities of micropeels. One thing that I want to mention is that each state has different regulations regarding what we know as dual exfoliation services. So please make sure that your state regs allow you to perform this service. And then the second thing is to make sure that you are insured for a service that's called a dual exfoliation service. Some of these conditions are contraindicated. For instance, if they have an active herpes lesion, like with all facial services, should be avoided, and it's contraindicated to perform any services on. If they have tendencies to have cold sores, it's advisable to let them know that they could experience potentially an outbreak and that they may want to go home and prophylactically pre-treat themselves with whatever their physician would recommend, or over-the-counter preparations like a Breva, just to ensure that they don't have a breakout. We know that this service is very stimulating, and therefore it could stimulate even some dormant herpes lesions. Active pustular acne, again, is another thing that I would like to see repaired as much as possible prior going into MicroPeels. Again, pustular acne, the skin is carrying a lot of bacteria. It probably needs a lot of extractions, which is not approved to use in the protocol of the MicroPeel. So I would like to control the acne as much first and then move on to MicroPeels once we can satisfy the inflammation associated with their acne. If any of your clients have rosacea, whether it's a subtype 1 or a subtype 2 rosacea, acute or chronic, it's probably not a good idea to perform this service. However, on those that have an occasional flare-up, and they may not be having an episode at the moment, potentially could tolerate it, but using your variables, turning all of it down a notch, using the lowest grit on the microderm tip, very low vacuum, and maybe one pass, potentially leaving the salicylic acid on over just 1 minute or so as an example. Always making sure that you're doing the patch test with the salicylic acid peel solution on all clients prior to performing the MicroPeel, just to ensure that they're not going to have any complications. Again, over any open sores, lesions, undiagnosed or suspicious looking anything on the skin should be avoided. Some questions that I get is, can I work around those? I don't suggest it. I suggest that the skin is completely healed or in optimum shape before they go into the MicroPeels for the most part, meaning there isn't any inflammation, redness, open sores. If there is anything undiagnosed or that looks suspicious on the skin, I do recommend that they see a physician first before we do this progressive service. Do the same thing here with any dermatitis, psoriasis, or eczema. Any known skin disorders that elicit any redness, discomfort, irritation, I do suggest that they either get their physician's approval to go forward with a service of this, or that the skin is in a more normalized state prior to administering the service. Also, if your clients are on Accutane or have been on Accutane for a minimum of 6 to 12 months, and have not been off Accutane for a minimum of 6 to 12 months, then we do recommend that they are through the course before they begin any series or receive a MicroPeel service. The reason for that is that Accutane tends to really dry the skin out, and it slows down the oil production in the skin, so we have a lot of transepidermal water loss, creating all sorts of dehydration in the skin. Dehydration, it really can lend itself to several other unwanted conditions that can elicit some sensitivity levels in the skin. So making sure, again, that the skin is somewhat normal before really going forward with MicroPeels. Like we mentioned earlier, the MicroPeel protocol is somewhat different for ClarityRx. One of the things that is required at the end of your course is that you'll be consigning a professional waiver, which just basically states 3 things. One is that you will follow the protocol that we put forward for you for safety for your clients and for your liability. The second thing is that we want to make sure that your state regs allow you to do this service. And third is that your insurance has been notified that you're performing a dual exfoliation service. Okay, prior to the treatment, we want to make sure we take a really good look at the client's skin. Barring any inflammation, redness, or anything that we should be concerned about, we can go ahead and get started. This is a standalone service. So this is not to be as an upgrade to any other service or to be used in conjunction with any other modality, such as LED, ultrasound, frequency, high frequency, microcurrent. None of that has been approved. This is just a standalone service. And so we want to use about a 1/4 teaspoon of cleanser and pre-cleanse the skin very, very well. Rinsing that cleanser very well, taking a couple spritzes of Take Your Vitamin spray, and then kind of patting it dry. I like to use a fan on the skin to make sure the skin is completely dry before I apply the salicylic acid peel. Why? Because if the skin is moist or has areas in which it's still moist or wet, the peel solution has a tendency to grab in those areas and can cause some hot spots, if you will. So we're going to go ahead and then, once the skin is completely dry, apply the salicylic acid peel, 1 application with the brush, not rubbing it in at all, not mixing, not blending any solutions, just straight salicylic acid, up to 3 minutes. Making sure that you are communicating with the client to make sure that they're comfortable. Prior to this, however, you would already have done a patch test. And in the patch test, we're looking for things like raised histamine rash-like effects, or lines of demarcation, or itching or burning, or change of color in the skin. It's not uncommon, however, to recommend that your clients will experience some frosting potentially while the peel solution is on. So if you're getting a little frosting, that is somewhat normal. Making sure that the client's comfortable the whole time. At the time in which you want to remove the product, you would spritz a couple of pumps of the Take Your Vitamin spray onto the skin, and then follow up and rinse with cool water and 4x4s. Please do me a favor and do not use sponges or towels for the cleansing process, removal process, or anything within this 30-minute protocol. They're just simply too scratchy. We have found that the combination of all of that is not a good fix. The 4x4s are much more comfortable for the client and much more less scratchy for the client's skin. Okay, well then once the skin is completely dry, and again you can use your fan, is you want to begin the microdermabrasion using really long, gentle strokes, keeping the skin very taut, and lower the vacuum if you're working on more sensitive or inflamed skin types. Make sure you're not dragging the skin. Remember that we've already exfoliated the skin fairly deeply, and the skin may be a little bit more vulnerable than if not. So, and proceed 2 times around the face with the microdermabrasion if the skin can tolerate it. In some clients, with their first time with MicroPeel, I may just do 1 pass to see how they do, and then I always let the skin speak to me. If the skin is looking too warm or hot, if the skin is showing signs of inflammation, if it seems red, if it's streaking at all, or anything that tells us that we should stop, then it's time to stop at 1 pass. Most clients, however, you'll find can proceed with 2 passes. Rinsing the skin down with cool water again, and your 4x4s, no towels again, and follow with a very thin layer of On the Mend post-procedure gel, fanning that into the skin and letting it dry, and leaving it on the skin. Leaving it in the skin, I should say. And then I like to follow it up with just a 1/4 teaspoon of the Nourish Your Skin, just to kind of lock in the skin's natural moisture and to protect the skin even more. This is a micronized, very nourishing oil, and so it also is a very strong antioxidant oil, and it just, like I said, locks in the skin's natural moisture. It's just a really beautiful finish for this particular MicroPeel protocol. You can also choose either the Feel Better or Calm Me in the Morning if you would want to, as well, if those are more appropriate for the client's skin and what you're working on. And then, of course, following up as a finishing product with a 1/4 teaspoon of the Skin Defense SPF 30 and or our new It's Becoming would be over that as well. So if you're using the Skin Defense, put that on first, allow it to thoroughly dry, and then to apply the It's Becoming Concealing Moisturizer over it. Okay, in addition to reviewing this MicroPeel protocol, you are also required this next lesson to view the hands-on video made available in your next lesson. So how often can we actually perform these on our service, or clients, I should say, is that MicroPeels really have a cumulative result, meaning that the more often we perform these for our services, the better the results are, and the longer the lasting the results are, I should say. Multiple sessions at monthly intervals seem to be kind of the sweet spot for this. If you're working on a skin type now that could tolerate it more frequently, then certainly you could do it more frequently as once a month, but most clients tend to find that the once a month is good. Your clients will feel a little tight, dry, and some moderate flaking and some moderate redness, like I said, for up to 3 to 5 days following this procedure. It's not uncommon for them to have little flaky spots or hot spots, some, like I said, some tightness or dryness. Again, just supplement the skin with lots of water and lubrication and lots of protection with their SPF 30, and they should be fine. Again, sunblock is mandatory throughout the process of receiving these services, as the skin's pretty vulnerable for the UVA and UVB rays. Okay, so the next step to the certification for MicroPeel is to take your next lesson, which is your video. You'll also be sent an exam and a waiver. And if you have any questions or if we can be of any support to you, just email us at education@clarityclinicalskincare.com. Thank you.